Welcome, and thank you for your interest in the Florida Bariatric Centers. This presentation will take you through some of the information you need to know about weight loss surgery, our facilities and staff, and the commitments and requirements of the patient, all to help you make an informed decision on the best weight loss option for you. Going the path of surgery to improve your health isn't an easy one. Rest assured, you have taken an important first step towards a healthier lifestyle with the experts at the Florida Bariatric Centers. The Florida Bariatric Centers are dedicated to offering you the latest advancements in the field of surgical weight loss, medically known as bariatric surgery. Our highly accredited hospitals are easily accessible throughout the entire Tampa Bay area and to the nearby communities of Orlando, Lakeland, and Sarasota. We recommend you watch this seminar in a quiet area. Have a pen and paper ready to take down notes or any questions that you may have. After you've reviewed the presentation, you can contact our office to ask any questions and to discuss the next steps, which may include a consultation. Our course objectives for this seminar are as follows. We know that your decision to have weight loss surgery is a life-changing event. We want your learning experience about surgical weight loss to be as comprehensive as possible. It's our goal to make the pre-surgical process as simple as possible, but we are going to need your participation and commitment. We appreciate your patience during this period and hope you understand that your health and safety are our primary concerns. The best preparation for your surgery is to understand everything you can about the various procedures and the process. Our healthcare team is in total agreement with your decision to change this pattern of obesity, and we will work with you to help you succeed. However, we need your help as well. Success will depend on you, the patient. You will be expected to commit and adhere to the recommended dietary, exercise, and lifestyle changes that we will be explaining later in this presentation. Let's get started. Obesity is a growing problem. It is estimated that every year there are nearly 400,000 deaths in the U.S. that are related to obesity. It's believed that the obesity epidemic is the #1 preventable killer, outpacing cigarette smoking. More than 50% of the population in the U.S. is considered obese. Weight loss surgery is known to be the most effective and long-lasting treatment option for morbid obesity and many of its related conditions. But now, mounting evidence suggests it may be among the most effective treatments for metabolic diseases and conditions, including type 2 diabetes, hypertension, elevated cholesterol, non-alcoholic fatty liver disease, and obstructive sleep apnea, to just name a few. Obesity worsens health and quality of life and also shortens life expectancy. Recent studies have concluded that obesity in adulthood is associated with a decrease in life expectancy of approximately 10 years in both men and women. Outlined on this screen are some common health implications of being obese. As you are probably aware, in addition to inflicting life-threatening disease, obesity can inflict emotional stress, hardship, and discomfort. Oftentimes, society believes the only cause of obesity is lack of willpower on the part of the overweight person. Even some obese people believe this and cannot understand why they have failed to take it off and keep it off. They are often left feeling hopeless after trying various methods to lose weight, including weight loss programs, diet pills, acupuncture, jaw wiring, and other ineffective remedies. Most often, they end up regaining any lost weight, plus a few pounds. Perhaps no other medical condition has been more misunderstood, maltreated, and misrepresented. The good part is perception is changing and surgery has gained acceptance as the only proven method to treat this disease. Let me repeat, disease. The underlying cause of severe obesity is not known. There are many factors that contribute, including heredity, low metabolism, poor diet, and excessive caloric intake. Your body mass index, or BMI, is a measure of body fat based upon your height and weight that applies to both adult men and women. Generally speaking, weight loss surgery is indicated for individuals who are at least 75 pounds or more overweight or have a BMI of 35 or greater. In some cases, a BMI of 30 or greater may be considered. To determine your BMI, use the chart on this screen or visit one of our websites as we have automated calculators. There are several options for treating obesity. The most common approaches for losing weight are diets, exercise, and weight loss drugs. Studies show that diets and weight loss aids rarely work in helping severely overweight people reach the goal of long-lasting weight loss, while professionally supervised diets that include prescription drugs show an average loss of only 6 to 9% of excess body weight. The question that one has to now ask is why surgery? It should never be for cosmetic reasons. It should primarily be for health reasons. Those include improvement in health conditions, sustainable weight loss, improve activities of daily living, improve self-esteem, improve one's own perception. Multiple weight loss attempts have failed, and we have proven that. Surgery can fail as well. It's merely a tool, not a cure. With commitment and follow-up, one can sustain weight loss with surgery. Now to discuss why you're here. At our facilities, we primarily offer 3 types of surgery. The least invasive is the adjustable gastric band. The middle of the road is the gastric sleeve procedure, and the most complex procedure, which has been done the longest in the U.S., is the gastric bypass. We feel at this time there is still insufficient evidence to generalize in favor of one bariatric surgical procedure over another. We'll be spending time with each procedure. We are firm believers that knowledge is power, so we'll be asking a few simple questions after each procedure for you to test your knowledge. This is the beginning of our partnership. With the adjustable gastric band procedure, an adjustable silicone band is fastened around the upper part of the stomach to create a new, smaller pouch. The band is connected to an access port below the skin. Through this port, the surgeon can adjust the size of the band by adding or removing saline to an inflatable balloon on the inner surface of the band. To many, the adjustability is considered an advantage as the surgeon can fine-tune things without additional surgery. The silicone band that is placed around your stomach is hollow. It's filled with a saltwater solution that is like the other fluids in your body. These adjustments are performed during simple outpatient visits in the surgeon's office. With the band, the food you eat moves slowly from the small upper pouch past the elastic band and onto the lower part of your stomach, where it's digested normally. As a result, you eat less food and feel fuller faster. You'll find you are content with smaller amounts of food and are not hungry between meals. Your gastric band will be adjusted to meet your individual weight loss needs. Some people lose significant weight with virtually no saline in their band. Others require a tighter band to lose weight. Now, if you become ill and are required to eat more, saline can be removed from your band. If you become pregnant and experience morning sickness, the band can be loosened. The key part, however, is that once these periods end, your band can be refilled so you can continue on your weight loss journey. The adjustable gastric band acts as a mechanism for sustained weight loss. After some time, you may find you hit a plateau with your weight loss. You're losing less. If this happens, your band can be tightened to allow your progress to continue. Like with any surgical procedure, there are always risks of surgery such as bleeding, infection, and pneumonia. One always needs to consider these risks versus benefits of losing weight. When you meet with your surgical team, they'll go over their specific statistics. Complications directly related to the bands include slippage, which ironically is not a band that moves, but a stomach that migrates up a bit. Another complication related to the band includes erosion, which creates a stomach perforation. With this complication, the band would need to be removed and the stomach hole stitched up. Meet one of our alumni who's now off of 5 different medications. And Carrie, who is 120 pounds lighter with the lap band. Now that you have watched the module on the adjustable gastric band, it's time to test your knowledge. Please read each question and select the best answer. You need to answer the questions correctly before you can move on to the next section. What is one of the most important elements of follow-up care with the adjustable band? A. Getting on the scale so one can keep track of their weight loss. B. Adjustments to the band which are performed during office visits. And C. To see your surgeon for a pep talk. The correct answer is B. Adjustments to the band which are performed during office visits. Let's move on to the next question. Here's our second question related to the adjustable gastric band. The band is the only weight loss surgery with a long-term tool that can be adjusted to help keep the weight off. A is true or B, false? The correct answer is A, true. And here is our final question for the adjustable gastric band. What are the 2 most common complications related to the adjustable gastric band? A. Indigestion and spitting up blood. B. Slippage and erosion. C. Nausea and vomiting. The correct answer is B. Slippage and erosion. Let's continue. The sleeve gastrectomy is often referred to as the middle-of-the-road operation, as it's more technical than the adjustable band, but not as complex as the gastric bypass. This operation is picking up momentum in the United States. Individuals who should consider this operation are those that are concerned about potential long-term effects of gastric bypass, those that are scared about having a foreign object, such as with the adjustable band, and individuals deemed too high of a risk for gastric bypass. This operation started out as a 2-part procedure, but the results were so promising that individuals were not returning for the second stage. The stomach is divided and a large portion, approximately 75% of the stomach, is removed. This is depicted on the picture on your right. The resulting edges are stapled, forming a tube-like stomach that resembles the shape of a small banana. The procedure reduces the size of the stomach, resulting in a restriction of the amount of food and therefore calories that can be consumed. Most can expect to lose 30 to 50% of their excess body weight over a 6 to 12-month time period. With the sleeve gastrectomy, we aren't doing surgery on your small bowel, so we're not affecting your absorbency at all. There's no foreign object wrapped around your stomach so that it eliminates the need for adjustments, which involve needle sticks. Also, the part of the stomach that is removed is called the fundus. This is the portion of the stomach that produces the hormones that stimulate hunger, ghrelin. In addition, the part of the stomach that is removed is actually the portion that stretches the most. The part you are left with is the least likely to expand, which is exciting news. Like with any surgical procedures, there's always risks of surgery such as bleeding, infection, and pneumonia. One, however, has to consider the risks versus benefits of losing weight. When you meet with your surgical team, they'll go over their specific statistics. Complications directly related to the sleeve are leakage from the staple line and poor gastric emptying. Shannon had the sleeve gastrectomy and lost more than 100 pounds in less than a year. Now that you have watched the module on the sleeve gastrectomy, it's time to test your knowledge. Please read each question and select the best answer. The sleeve procedure works by A. Restricting the amount of food you can consume due to a small stomach and altering the hunger hormone. B. Restricting the amount of calories you can consume and altering your digestive tract, resulting in an element of malabsorption. C. Creating a dislike to all types of foods. The correct answer is A. restricting the amount of calories you can consume due to a small stomach and altering the hunger hormone. Here's the next question on sleeve gastrectomy. When talking about the sleeve, why is removing the fundus considered an advantage? A. The more you can get rid of, the better. B. You are removing the part of the stomach that stores the hunger hormone and leaves the cartilage part of the stomach, which is less likely to stretch over time. C. The fundus reacts violently to sugar. The correct answer is B. You're removing the part of the stomach that stores the hunger hormone and leaving the cartilage part of the stomach, which is less likely to stretch over time. Let's continue. The gastric bypass has been performed the longest and by some is considered the gold standard by which all other weight loss surgeries are compared to. Saying that, it's the most complex of the 3 operations performed at our program. The surgery works 2 primary ways. The stomach is stapled in 2 sections. The stomach labeled as number 1 becomes a small pouch that serves as the new stomach. The size of the stomach restricts or limits the amount of food you can consume. You'll feel full and satisfied with a much smaller caloric intake. The bypassed portion of the stomach, labeled number 2, no longer receives, stores, and mixes with food, but remains functional by continuing to secrete digestive juices. We then surgically divide the small intestine and connect it to the new small stomach and pouch, number 3. Now you absorb less. Food now bypasses part of your digestive system, which reduces the amount of calories your body absorbs. Due to the restrictive nature and element of malabsorption, this operation potentially offers the fastest weight loss. 2 other important features include the dumping syndrome and lack of the hunger hormone in your system for a short duration, 12 to 15 months approximately. Both of these are worthy of spending more time on. The dumping syndrome, it's related to the ingestion of refined sugars or high glycemic carbohydrates. These foods rapidly empty from the gastric pouch into the small intestine, which triggers a cascade of symptoms such as heart palpitations, sweating, nausea and vomiting, as well as diarrhea. If you do dump, the likelihood of you eating that food in the near future diminishes, so in essence, it's forced behavior. The downside is that dumping makes you feel awful and can wear you out. The other contributing factor to the rapid weight loss is that the hormone that stimulates appetite is greatly diminished after a gastric bypass. Unfortunately, in time, our patients do report some appetite returning, so once again, we need to stress that weight loss surgery is just a tool and behavior modification is very important. Like with any surgical procedure, there are always risks of surgery, such as bleeding, infection, and pneumonia. One, however, has to consider the risks versus benefits of losing weight. When you meet with your surgical team, they will go over their specific statistics. Complications directly related to gastric bypass are intestinal leakage, anastomotic stricture, and vitamin and mineral deficiency. Meet Vicky, who had gastric bypass several years ago and is an advocate of weight loss surgery. Now that you've watched the module on gastric bypass, let's test your knowledge. Please read each question and select the best answer. Known complications of gastric bypass are A. Intestinal leakage, anastomotic stricture, and vitamin and mineral deficiency. B. Heart attacks leading to death. C. Unrelenting nausea and vomiting. The correct answer is A. Intestinal leakage, anastomotic stricture, and vitamin and mineral deficiency. Here's the next question on gastric bypass. Dumping syndrome occurs only with the gastric bypass, and it's considered forced behavior modification. A is true, B, false. The correct answer is A, true. Weight loss does differ from patient to patient, and the percentage of potential body weight loss can differ by procedure. Please remember that these operations are merely tools. If you work your tool, you'll experience weight loss with any of the procedures. Your surgical team will be placing you on a high-protein diet prior to your weight loss surgery. We refer to this as a liver shrinking diet. If you are overweight, there's a good likelihood that you have a fatty, engorged liver. We want to make your surgery as safe as possible, so one of our goals is to shrink your liver a bit. This means your liver will be smaller and easier to move out of the way during the surgical procedure, which is a benefit, especially during laparoscopic procedures. A smaller liver can also result in less time being spent under anesthesia, which can lessen the risk of complications. Why high protein? Well, the importance of protein cannot be overstated. A diet with adequate protein ensures that you lose fat, especially abdominal fat, which can interfere with surgery, and maintain lean muscle mass even while reducing your caloric intake. A balanced and nutritionally rich high-protein diet ensures that your body will have everything it needs to recover well from bariatric surgery. The high-protein liver shrink diet also helps you acclimate yourself to the higher protein, reduced caloric, reduced carbohydrate diet that you'll have to follow after surgery. Now, here's diet specifics. The specifics of your diet will be determined by your physician and your medical team. Expect to consume low calories, between 70 and 120 grams of protein daily, as well as a multivitamin mineral supplement. Some physicians prescribe all liquid diets consisting of protein meal replacement products such as shakes. Some physicians specify certain products while others allow you to make your own choices within certain parameters. Your medical team will choose a diet for you based on your needs and goals, your health, and the procedure that's planned for you. Most of our patients are required to diet for 1 to 2 weeks before surgery, but each are treated individually, so it could be longer. Don't drink calories. Your caloric intake will be very limited after surgery, which should help you lose weight. Don't work against your surgery by taking in liquid calories that provide no nutrition and slow your weight loss. Make every calorie count by focusing on proteins and greens. Chew and then chew some more. Chewing your food thoroughly is essential to preventing nausea and vomiting during and after your meal. Large chunks of food can have trouble passing through the digestive tract after surgery, and if it gets stuck along the way, it can cause pain. Don't drink fluids during or immediately after your meal. It's essential that you reserve the small amount of space you have in your stomach for high-quality, nutrient-rich food. Drinking during your meal will fill your stomach with fluid instead of food, and drinking immediately after your surgery can wash food out of your stomach, making you feel hungry sooner. Separate food and fluid by at least 30 minutes whenever you can. Protein, protein, protein. Protein should be your primary focus when sitting down for a meal. Not only will it help you maintain your muscle mass while losing fat, but it will also help you feel fuller longer after your meals. Avoid carbs. Carbohydrates are highly processed foods such as bread, pasta, sugar, and rice. Carbs make your blood sugar climb, cause hunger pangs, and provide no nutritional value. Avoid high-caloric liquids such as alcohol. These are considered empty calories that provide no nutritional value. Eat mindfully. No more eating while watching TV. Focus on what you're doing when you eat and stop the moment you feel full. Giving food your full attention will help you learn to say when and develop the new healthier habits. We recommend a portion size equivalent to a smartphone. Only you can decide if weight loss surgery is right for you. Thousands of others have already entrusted us with their care. We have a comprehensive program with skillful surgeons, mental health counselors, nurse liaisons, support groups, dietary education, and insurance counselors. We offer compassionate care to help you gain a whole new life by losing your excess weight and keeping it off. Please call 866-931-THIN. That's 866-931-8446 to schedule your in-office consultation. Also, confirm with the representative that you have reviewed the online seminar and new patient orientation. Thank you.